Did you know that healthcare-acquired or associated infections, or HAIs, cost healthcare facilities billions of dollars each year, along with tens of thousands of lives? To make matters worse, different healthcare facilities have different infections they need to be worried about. An acute care hospital is going to be a lot more concerned about MRSA than a long-term care facility, just as long-term care facilities may be more concerned with C. diff than an acute care hospital. It's a concerning reality, but don't worry. In recent years, it's become increasingly clear that there are a number of effective methods for preventing HAIs. In fact, today, we're going to tell you about 3 game-changing ways to help prevent HAIs. Let's dive right in. Our first tip is to promote proper hand hygiene for everyone, including employees and patients. Hand hygiene is the first line of defense against any infection and disease, and this is especially true of HAIs. When it comes to hand washing, the World Health Organization advocates a gold standard known as the 5 moments for hand hygiene. There are 5 key moments when hand washing is vital: before touching a patient, before a procedure, after a procedure or exposure to bodily fluids, after touching a patient, and after touching the patient's surroundings. This practice is widely accepted across the U.S. healthcare facilities, and following it can drastically reduce the likelihood of spreading or developing HAIs. Now let's talk about hand washing technique. According to the Centers for Disease Control, a quick rinse just won't cut it. You need to follow a 5-step process. Wet your hands, lather in soap, scrub together for at least 20 seconds, rinse off, and dry with a clean paper towel. Trust me, those 20 seconds makes all the difference in curbing the spread of HAI-causing bacteria. Moving on to our second tip: cleaning and disinfecting portable medical equipment. Ever heard of instructions for use, or IFUs? You can think of them like manuals for medical equipment. Each manufacturer provides a set of guidelines on disinfection specific to their equipment. Refer to those IFUs for the recommended cleaning routine and the most effective disinfectant to use with that particular piece of equipment. Following IFUs isn't just about cleanliness, it's about protecting the warranty and serviceability of the equipment. Doing so ensures that the equipment stays in top-notch shape and minimizes the risk of cross-infections. Lastly, let's look at our third tip: assembling a facility-wide infection prevention team. This team is composed of a variety of healthcare workers like nurses, environmental services, and infection prevention specialists. They are all united under the common goal of combating HAIs. This team is responsible for collecting data on infections, identifying root causes, and devising effective responses. It's about proactively tackling the issue rather than reacting to it. The infection prevention team doesn't just fight the battles, they prevent them from happening in the first place. There you have it, 3 powerful tips for preventing the spread of HAIs in healthcare facilities. I hope you learned something new in this video. If you still want to learn more about HAIs or are interested in further exploring any of the tips we've covered in this video, please consider reaching out to an Imperial Dade facility rep near you. One of our cleaning experts is ready to assist you in assessing your facility and getting you on track to adopt the 3 methods we've covered in this video.